Within the medical field, whether it be the years of studying as a student or as a professional who has been working for many years, the way individuals are taught have a profound effect on how the information is learnt and how well it was remembered. Using methods of reflection for an individual's practice can be a very inept way of learning what is correct and what mistakes were made. One reflection method that can be used is debriefing with other members of your cohort or profession. Debriefing is often defined as a learning experience through a collaboration of opinions and knowledge on the events that took place in a case as a whole, often answering questions and supporting each other. The method of debriefing is often found in areas of teaching and within real-world professions to reflect on performances and methods within a simulation or real-life case. In a teaching environment, debriefing after simulations is common and has been found to be beneficial for those who underwent the simulation as a learning tool, commonly seen as a discussion between teachers and students about what went right, what went wrong, and what would be done differently next time. Information and studies on the effectiveness that debriefing has on specifically paramedics and paramedic students are not abundant. So studies with nurses as the subject were used as they have a close learning curriculum to paramedical students. Within the real world of health professionals, debriefing is done after a case has been completed and commonly includes all the health professionals and other emergency services that were present for the progression and completion of the case. To follow as closely to the real-world practices as possible, teaching organizations often perform a post-simulation debrief, with a full simulation finishing before any questions or critiques are given, and then once finished, then using this as an opportunity to debrief. An increase in short-term clinical reasoning has been found to be associated with debriefing post-simulation, as well as reinforcing the link between simulation practice and real-world practice. For the debriefing to be effective for students, the post-simulation debrief should be well organized and in a comfortable, non-threatening environment capable of an open discussion. There have been multiple methods that have been found best to perform when debriefing with others to ensure the best possible chance for information uptake. One of the more traditional methods used in a teaching setting includes the discussion between the teacher and student along the lines of learning objectives that needed to have been hit during the simulation. This line of debriefing follows a traditional line of questioning for the student to answer what was done right, what was done wrong, and what could be done differently next time, and focuses on performance criteria. Using these questions for a student to answer initiates the use of their deductive thinking, which also activates their critical thinking, ending with the student evaluating their own performance and what they can do to improve. Other forms of student debriefing that have been found to be an effective way of initiating the reflection process of an individual's skills and decisions is the method known as non-judgmental debriefing. Instead of focusing on critiquing performances, like the more traditional form of debriefing, the non-judgmental form of debriefing uses a form of inquiry to induce the reflection process within students. This starts as the teacher stating an observation. This observation may have been seen during the simulation, for example, why a skill was performed or how the student came up with their diagnosis. This process then leads to the student then explaining their process or answer. This prompts students to make clear their interventions and understanding of the simulation. The use of debriefing as a tool for reflecting on an individual's practices has been used in the learning field for a long time, but as a paramedic on road, learning is still a requirement every day, and reflective practices are seen outside of the classroom setting just as much as seen in it. In a study conducted by Lavoie, Pepin, and Boyer, wherein nurses working within the intensive care unit reflected on their information uptake and satisfaction when using debriefing as a tool after simulations and how it helped them in their job. The results of the study showed that all participants believed that debriefing reflectively helped improve their cognitive processing for simulations and increase their clinical judgment development. Overall, clinical debriefing was found to be a way for health practitioners to effectively learn from experience and improve their clinical judgment. Although debriefing itself is a form of reflecting on an individual's or group's performance and abilities, the most effective way of letting a person reflect is to follow a format that is known to be able to improve people's learning opportunities. The most effective way of letting a person reflect is to follow a format that is known to be able to improve people's learning opportunities. Studies were conducted to test students' clinical judgment who underwent an unstructured form of debriefing and compare it to students who were involved in a structured debriefing session. This study was to determine whether using a structured debriefing would positively increase the impact of a student's reasoning skills compared to an unstructured approach. Using 6 components to structure the debriefing process, students within the control group underwent a structured method of debriefing. These components included engage, evaluate, explore, explain, elaborate, and extend. Following these 6 components of the reflection process is found to target a person's knowledge, skills, and the opinions about the learning experience within the debriefing process. The results of the study showed that the clinical judgment mean values of the structured debriefing group were higher, as well as improved more over time when compared to the unstructured debriefing group. These scores, however, were found to be not statistically significant enough with the size of the group study. In my own personal experience throughout my study life, I have had lots of encounters with teachers and mentors that have provided me with many debriefing sessions that I have been on the receiving end. In my university career as a paramedic student, conducting many simulations, both assessed and not, I have received feedback from many tutors and assessors which have been thoroughly integral to me improving my skills and knowledge. From researching the theory behind debriefing, it has become apparent to me that I have been approached using both debriefing techniques, as explained previously, both making me reflect on my approach to the simulation and the outcomes. However, from my opinion, I prefer the use of the non-judgmental style of debriefing, as it provides me with the opportunity to explain to my tutors my way of thinking and approach to the simulation before the tutor's thoughts of how I went affects me. While I am on placement, I find debriefing to be a much more personal experience, and I have found that it has been based more so on my scene control and the quickness/appropriateness of my treatment. An experience that comes to mind is when a patient who was within a house with little room and impaired patient mobility. At hospital after the case, a traditional form of debriefing was used by my mentors to talk through how scene management and patient care could have been improved. On other cases, where the whole crew went through debriefing, it was more about what we did well as a team, what we could have done better, and what should we do next time if the same case were to present itself. Debriefing on road not only helps with finding ways to improve your clinical abilities, but also can help with cases that paramedics might have found overwhelming. Initiating talking to co-workers through debriefing can help with how individuals may have felt after the case and help with their mental state. All this information suggests being a health practitioner requires a level of reflection upon one's own abilities and actions. Using debriefing as a tool to initiate and enhance the reflection process to provide students and paramedics with the most efficient way of improving our clinical skills and abilities. Health practitioners believe that debriefing after simulations and whilst in the workplace has helped them in learning more and in their abilities to remember new ways of approaching a situation and learning from previous mistakes to become a better clinician in the future. From my research, I believe that clinical debriefing is a helpful and essential skill in a paramedic learning approach and will help me become a more efficient health professional.